Hello, everybody. My name is Alexandre. I'm from the social media team for the PVI Congress that's about to happen at the end of the year. And today we have the pleasure to have with us Dr. Fanelli. So hello, first of all.
Hello.
And for those who don't already know you, would you mind introducing yourself?
Absolutely. My name is Fabrizio Fanelli. I'm an interventional radiologist, and I'm the director of the vascular and interventional radiology department at the University Hospital in Florence in Italy. And I spent my last few years especially focusing more on peripheral arterial disease.
Mm-hmm. Okay, and for this reason, you are also member of the scientific committee for the Congress about peripheral arterial disease, right?
Yeah, since last year I had this privilege. So we have to do it again.
My first question, yeah, of course, and I think it will be
if you
good
want,
this year too. My first question will be on the recent PAD guidelines that have been published, especially this year. What do you think is the main impact of those guidelines on daily practice, whether for you or for other practitioners?
I think this is a very interesting topic. Yeah, we had new guidelines coming last May from the American College of Cardiology, and we are looking forward to the new European Society guidelines, by the end of August. I think this is very important because nowadays we have a lot of devices, a lot of techniques, especially combining multiple devices together. And sometimes we are not sure which is the correct selection or if it is the correct selection. So I think the guidelines can help everyone to select the most appropriate device or procedure. And what is also important that nowadays we are speaking more and more about a multidisciplinary approach. So indication must be discussed previously before the procedure with our colleagues and then define the best strategy for our patient.
Okay. Regarding peripheral arterial disease, there are significant patients, a lot of patients that remain a challenge to tackle, whether it's on infrainguinal disease or below the knee. Regarding the recent publications, specifically on infrainguinal disease, do you think that scaffolding is making a comeback?
Honestly, I think yes. What we observed in the last few years that with the introduction of the drug-eluting balloons, there was the majority of the physicians were more focused on the famous nothing left behind. So just to try to do angioplasty, and avoid the use of stent. However, we learn a lot about the limitations of drug-coated balloons, especially when we have a heavy calcified lesion or complex morphology. And those patients are where we can get a better outcome if we scaffold the lesion using a stent. Now, this could be a drug-eluting stent or a bare metal stent in combination with other devices. But I think especially for below the knee, the use of a stent can improve the outcome, especially for calcific lesions.
Yeah. So regarding the recent publications, like the live BTK trials, and all of those publications surrounding that, what do you think would be the next steps for bioresorbable stents?
This is a very cool topic, and I think this will be something that we can also discuss during the next PVI meeting in Paris in December. This is the new frontier, for endovascular treatment, because the goal is to have a scaffold or a drug elution for a certain period, and then have a native vessel with nothing inside. Now, the focus is more correlated to the below the knee region. As you said, we have an FDA-approved device, and from my knowledge, there are other 4 or 5 in the market that are going to be evaluated. For SFA, there is only one, if I remember well, but I think this is a very promising or something very interesting for us. Obviously, we need a lot more data because at the moment there are no data. And we know also the limitations of all these devices in terms of radial force, visibility, and so on. So in my opinion, we are in the first step of this treatment modality. But I think that in the future, this will be more and more popular in our daily practice.
And speaking of some of you said about drug-eluting device. Do you think that in the next years, the limus-eluting device are coming to be the new standard? What are your expectations regarding those kind of device specifically?
This is a very good question with not an answer. It's a 1 million answer. Yeah. We know the limitations of paclitaxel are already well known. We know also that there are good data coming from the initial experience using limus device or catheters. The problem, in my opinion, is that at that moment, nowadays, we have already 5 years follow-up or more or using the paclitaxel devices, either a balloon or a stent. And on the opposite, we have just few data regarding limus. So the problem will be to compare the two drugs and to see not only the outcome at 1 year, but what we want to see, especially for claudicants and young patients, who have the same outcome also after 4, 5, or 6 years or more. So I think there is a lot of interest in this area, but we need more data. And again, this is another interesting topic to be discussed at PVI.
Yeah, well, thank you very much. I think these are all very interesting topics, and we'll have the pleasure to see you and to hear about this, to discuss this at the next PVI Congress. Thank you very much.
Thank you. Enjoy.